Hi everyone, my name is Elizabeth Maxwell, and today we'll be talking about the global health risks of increasing ambulance light and siren utilization. But first, a little bit about me. I'm a rising senior based in New Jersey, and I attend Northern Valley Regional High School at Demarest. In terms of my interests and extracurriculars, I'm an emergency medical responder in my local ambulance corps, and I treat patients during 911 calls, which is what initially made me interested in this topic. Outside of school, I founded the Eating Disorder Subcommittee at the New Jersey American Academy of Pediatrics, which creates media content for pediatricians and registered school nurses to promote recovery for youth with eating disorders. In the future, I aim to receive a bachelor's in public health, do a dual master's program for public health and health administration, and eventually direct a nonprofit or a local department of public health in various cities within the United States or even outside of the country. To introduce this topic, I'd first like to make it a little bit personal. I believe everyone can relate to seeing an ambulance drive by and turning their heads. There's blinding lights and blaring sirens that make them difficult to ignore and oftentimes distracting. Historically, lights and sirens have been used across the globe for emergency medical services, or EMS, since the 1700s, ultimately to transport patients to a medical facility as quickly as possible in order to increase the likelihood of better patient outcomes. As they began to be used with increased frequency, the utilization began to be investigated and questioned, which we'll dive into within this presentation. While this may not seem like a public or global health issue as it avoids consideration of strictly clinical research, lights and sirens impact the safety and health of EMS personnel, patients, and bystanders, and we must investigate their hazards to prevent any unnecessary dangers in our communities where citizens are continued to be endangered by the very services meant to save their lives. So let's investigate this problem. The purpose of this presentation is to bring attention to ambulance light and siren health-related risks, highlight their frequent and increasing utilization that exacerbates those risks, and propose potential solutions that balance public safety and fast transport times. So let's first talk risks. Is this a global health concern? And if it is, why should we care? The first risk of lights and sirens is motor vehicle collisions involving an ambulance. In 2016, the National EMS Information System concluded that during ambulance transportation, no light and siren utilization had a crash rate of 7 out of every 100,000 calls, while using lights and sirens had a crash rate of 17 out of every 100,000 calls, more than double, showing that lights and sirens increase the likelihood of a vehicle collision. While ambulance collisions are primarily safety incidents, they become public health concerns because of their direct impact on health outcomes, especially when they injure patients or EMS workers. The second main risk of lights and sirens is the sirens themselves. Researchers discovered that the mean siren noise was 102.5 decibels, which is very, very loud. Using a hearing acuity test, it was discovered that paramedics have a mean hearing threshold of 2 to 5 decibels below the general population, exhibiting how excessive exposure to such loud noise impacts the health of our own frontline EMS workers. Concerning noise exposure effects, the World Health Organization recommends 30 to 40 decibels for sleep and working conditions. Otherwise, it can result in elevated stress levels, sleep disturbances, cognitive impairment in children, cardiovascular disease, anxiety, depression, and psychological distress. Considering that sirens are often around 100 decibels, an ambulance stuck in traffic or parked can have significant effects on the community around it because the time of siren use is prolonged. Ultimately, sirens have severe health implications for EMS personnel, patients, and bystanders. Finally, let's talk lights. Beyond lights' effects on prompting motor vehicle crashes, numerous pieces of evidence suggest that the flashing lights of ambulances can have harmful health effects on communities. Around 100,000 Americans and thousands of individuals worldwide have a specific form of epilepsy called photosensitive epilepsy, which is known to cause seizures from flashing lights at certain intensities, like the lights on EMS vehicles, causing unnecessary medical harm to bystanders around these lights. Other researchers have concluded that flashing lights can trigger photophobia, a sensitivity to light. Researchers from Harvard Medical School found that during migraine attacks, 90% of individuals experience photophobia and find even low levels of light to be glaring or painful. As a result, those with these health conditions can be caused pain by the intensity and pattern of flashing ambulance lights. But you might be wondering, what about the benefits of lights and sirens? Most people would immediately point to the fact that lights and sirens can get an ambulance to a medical facility faster. However, lights and sirens don't have as much of an effect as people believe. One researcher found that using lights and sirens got an ambulance to a medical facility by an estimated 43.5 seconds to 3.8 minutes faster than an ambulance that didn't use lights and sirens. However, this time saved often has little difference on patient outcomes. Specifically, one study in which a physician reviewed 75 patients concluded that the time saved by lights and sirens may have benefited only 4 to 5% of patients. Therefore, the time saved is hardly ever necessary, and many researchers believe it does not justify the negative impact of light and siren usage. Alright, so light and siren use often has more cons than pros in terms of one's health. But are they even really used that often? Is this a public health concern in the first place? Well, let's go back to how I began the presentation. People globally hear sirens almost every day. While anecdotally this may be hard proof, let's look at the evidence. A 2011 survey in the United States of 108 EMS personnel estimated that they use lights and sirens on 82% of their calls. And a 1991 analysis in Pennsylvania discovered that 56.5% of patients were transported using lights and sirens. These high rates imply severe health consequences for EMS workers, their own patients, and bystanders subjected to light and siren qualities. Yet, while light and siren use is high, it is technically possible that it has decreased in recent years, following the publication of all the scholarly research regarding the detriments of light and siren use. However, there was no research depicting this, so I conducted my own independent study. I chose to investigate the frequency of light and siren use in the most densely populated region in my country, as light and siren use by EMS agencies in that area would impact a greater number of people per square mile. Therefore, should there be an unfavorable outcome, such as an increase in light and siren use, it would be deemed more of a public health concern and I could pursue a more intense call to action. As I live in the US, this region happened to be the state of New Jersey. I contacted over 30 ambulance corps in North Central and South Jersey to get a good geographical representation of the state. I asked ambulance corps administrators to provide me with their light and siren data from the years 2018 to 2024. And by using the formula how many calls use lights and sirens over how many calls there were total times 100, the rate of light and siren use per corps can be determined, and changes in this percent value can be analyzed from 2018 to 2024 to answer my question. On the right, you can see an example of data collected from Town A for each year from 2018 to 2024, and in the far right column, you can see the percent frequency of light and siren use. I compared percentages from 2018, which is point A in this image, to 2024, point B, for each town ambulance corps. In this image, you can see how I determined an average increase or decrease in light and siren use over this time period. I then averaged this percent difference for all the town data I gathered and found that there was an average 13.9% increase in light and siren use over the past 6 years. While my analysis certainly has limitations such as the small sample size, I conclude that light and siren use rates are not only high already, but are also increasing in some regions, implying continued and exacerbated harm to EMS personnel, patients, and bystanders via motor vehicle collisions, noise exposure, and negative light-related health outcomes. As a result, I posit that we need to decrease the frivolous utilization of lights and sirens. There are three main ways I believe we can help fix this issue. Currently, there are very ambiguous guidelines for when to employ lights and sirens that allows them to be used frequently, like telling EMS workers to use them when they think a patient's condition is, quote, life-threatening, which can mean different things for different people. Therefore, we need specific criteria and reasonings for when lights and sirens should be used. Secondly, we must hold EMS personnel accountable when they do use lights and sirens. As other scholars have posited, I believe various regions across the United States and the world should require EMS personnel to provide a reason for their light and siren use in their patient care reports. That way, personnel must think twice before using lights and sirens rather than using it as a reflex or instinctually because they have to later justify it. Finally, I believe there should be better dispatching or the transmission of information regarding the call. Oftentimes, EMS personnel will have a dispatch regarding something vastly different to the true event, so they may rush to a scene with lights and sirens that isn't at all life threatening. Ultimately, these solutions will all help discern life threatening from non life threatening emergencies to utilize lights and sirens more effectively and safely. Here are my references. Thank you for listening. Here's my contact information if you'd like to contact me, and have a good day.